Snoring on its own is not necessarily a nasty thing, but it does denote that there is a temporary blockage of the airway during sleep due to the laxity of the structures that are above the vocal cords. Now, when there's a partial collapse, and if it's not permanent, it may not necessarily cause the child any disability. However, in some cases when there is a persistent blockage, the breathing will stop and the snoring will stop at the same time, only for it to resume afterwards when the child remembers that it needs to breathe. Now, that's when you have a patient with apnea. And if this persists, then you need to see an ENT doctor in order to try and evaluate the child to see if more often than not, removal of the tonsils and adenoids will relieve that obstruction and enable the child to thrive. The operation itself is a low-risk operation, but it's not done without considering the pros and cons of doing the operation. Snoring could also arise because the nose is blocked, and that's when it causes the patient to breathe through a mouth, resulting in the palate falling back onto the back of the throat, causing the same effect. So the ENT surgeon will want to evaluate the child for nose problems and throat problems and decide which best to deal with in order to alleviate the snoring, or more importantly, the sleep apnea.